Hi, everybody. Today we are going to focus on the cardiovascular system anatomy, with the focus being on the heart. So let's go ahead and get started. So uh, to start with, looking at the heart is identified as a muscular double pump. It is divided to the right side and the left side. And associated with the right and left side of the heart, we have two separate circuits or circulation. We have pulmonary circulation. Pulmonary implies we are associating that with your lungs. And uh, when we talk about systemic, that basically means we're talking about body tissues. If you guys remember, your organizational level, we had chemical levels, which went to cell, to tissue, to organs, organ systems, right? So even if you're talking about tissues, basically we're also talking about the body systems, hence the word systemic circulation. Now, you guys are going to see this color coding in terms of blood vessels throughout the PowerPoint, and basically anytime you look at the heart anatomy and blood vessels. You're going to have two main colors, what you depicted here as blue versus red. Blue color implies this is the oxygen poor blood versus CO2 rich blood. Another way we can refer to this blood as deoxygenated, as in it has lack or it is lacking oxygen. Versus the red color implies that it is oxygen rich, CO2 poor, which also referred to as the oxygenated blood. Now, looking at this circulation, again, one of the main points that I want you to understand is that the heart is a double pump. So you have your right side of the heart. Again, this is anatomical position. So this is your right side and this is your left side. You have a blood that is deoxygenated coming from your body, and it comes in through the right side of the heart. It enters from the superior aspect of the heart, goes down to the inferior aspect on the right-hand side, and then it gets pumped. Again, heart is a pump. It is pumped into your lungs right here, where you basically have what we identify as gas exchange. You drop off your carbon dioxide in the lungs and you pick up your oxygen. So your blood goes from blue, which is deoxygenated, to red, which is oxygenated. Now this oxygenated blood comes back to the heart, enters from the superior aspect, goes down to the lower or inferior aspect of the left part of the heart, and then is pumped out of the body out of the heart into the body. Again, here is your secondary gas exchange. You give up your oxygen to the tissue and you pick up the CO2 from your tissue. So blood goes from oxygenated to deoxygenated. Now, as we mentioned, you can see two circuits or circulation. One that is sending blood to the lungs and then picking that up. So this circulation is identified as the pulmonary circuit or pulmonary circulation. And the one that sends oxygenated blood to the body and picks up that deoxygenated blood. So basically what you see as the bottom half in this picture, that is the systemic circulation. So let's start by looking at the heart in terms of the layers that surrounds the heart in terms of protection and the layers that form the heart itself. So the layers that are found around the heart, the outermost layer is called pericardium. Again, the word cardio implies associated with the heart. So pericardium is a fibrous pericardium, which is again the outermost layer of the heart. It is made up of dense connective tissue with the goal of protecting the heart. And then what you have next is what we identified as the serous pericardium. The word serous should sound very familiar to you because we discussed it earlier in our unit 1. Basically, this is a double layer membrane made up of parietal and visceral. Parietal being the outer layer and visceral being the inner layer. So serous pericardium, which has two layers, the parietal layer of this serous pericardium is belonging to the layers that protect the heart. So the fibrous pericardium and the parietal layer of serous pericardium are both surround the heart and with the goal of protecting the heart tissue. The second layer, which is the inner lining, is visceral layer of the serous pericardium, which is also called epicardium. And this actually belongs to one of the three layers of the heart. So this number 2, which is the visceral layer, is not technically part of the layers that surround the heart. It is the part of the layers belonging to the heart itself. So what are the heart wall itself made up of? As we just mentioned, the outermost layer would be called epicardium, and this is also the visceral layer of the serous pericardium. This is the heart itself, guys. Don't mistake this. Epicardium, or the visceral layer of the serous pericardium, is part of the heart itself. The parietal layer of this is the layer that surrounds the heart. Now, myocardium, the word myo should sound very familiar. That's implying muscle. So myocardium means heart muscle. This is basically the layer that is going to allow your heart to continue the pumping action. And the inner lining of your heart chambers is called endocardium. Remember, endo means inside. This layer is made up of simple squamous epithelium, which again lines the internal chambers or walls of the heart. So let's take a look at it in a picture. Again, this is kind of giving you a good idea. This layer that you see kind of look like threads. That's your fibrous pericardium. It's a thick layer, right? Outer layer. Then see, this is a double layer membrane. This one, and then this one. The one that is the outside layer, that's the parietal layer of the serous pericardium. The inner lining, this one right here, which is the visceral layer of the serous pericardium, also called epicardium, is part of the heart wall. Then you have this thick layer. Notice how it looks like muscle, because it is muscle, called myocardium. And again, the inner lining of the chambers of the heart would be referred to as the endocardium, which is made up of simple squamous epithelium. In terms of positioning of the heart, your heart is located within your thorax. It sits sideways with part of the heart, the inferior aspect of the heart, sitting on the diaphragm, which is this dome-shaped muscle right here. The superior part of the heart, where all of the blood vessels are exiting the heart, is known as the base of the heart. And the pointy part of the heart, which basically creates an indentation inside the left lung, that's called the apex of the heart. Notice again, quite a few blood vessels in terms of coloring. Anything you see in blue, and we'll discuss them again over and over, are carrying deoxygenated blood, and anything depicted in red will be carrying oxygenated blood. Here's a picture for the heart inside the human cadaver. Again, here is the heart. Notice again, it sits sideways. A good way for you guys to recall left versus right. The apex of the heart always points toward the left. And here is again within the thorax, it is protected by the rib cage as well as the sternum. Now let's take a look at the chambers of the heart. So heart has 4 chambers, and it is these chambers are separated by a muscular layer that sits between, called the septum. Now, we only labeled interventricular septum here, but you also have interatrial septum, which are basically on the superior part, versus interventricular is on the inferior aspect of the heart. Now, let's take a look at the 4 chambers of the heart first. So the 2 top chambers of the heart is referred to as the atria. If you're talking about one single one, these are called atrium. And the job of the atria is to receive blood. So they're identified as the receiving chambers. So again, what this means is that if blood needs to get access to the heart, it doesn't matter if it's the right side or the left side, it's going to be received by the atria. So again, right atrium and left atrium. Because these atria do not necessarily need to pump blood in terms of long distance or with significant amount of pressure, their muscular wall is relatively thin. So these are thin wall. Now it says it receives blood from pulmonary and systemic circuits. So where is that pulmonary? Pulmonary is if you're identifying them, would be your left atrium, and it becomes again clear as we go through this PowerPoint later on. Sorry, 1 second. Let me show you what this means. So kind of introducing the concept. Receive blood from the pulmonary, that would be your left atrium, because again, the blood is already oxygenated and is coming back to the heart, and the receiving systemic circulation blood would be your right atrium. Please pay attention to the color coding that I'm using. Left atrium is oxygenated blood. Again, left side of the heart is receiving oxygenated blood versus the right side is receiving deoxygenated blood. Now, on the surface of the atria, on the outer surface, you have these little pouches or extensions called auricles, and these are utilized when there is a significant amount of blood flow back toward the heart that allows the heart to basically expand its, or more specifically, the atria to expand its volume, basically receive more blood through either pulmonary circuits or the systemic circuit. Lastly, their wall muscle that is forming inside the atria, they create a specific pattern inside the heart muscle called the pectinate muscle. So let's take a look at these structures we described so far. So here is your right atrium over here. Here is your left atrium right here. Notice the patterns of the muscles that you see right here. These are called the pectinate muscle, and they're mostly present in the right atrium. And again, the blood that is on the right side of the heart would be deoxygenated, and blood on the left-hand side would be oxygenated. Lastly, the separation, we said it's the septum. So here is the septum that is separating the bottom half of the heart, called the interventricular septum. So let's go ahead and look at our bottom chambers. The bottom chambers of the heart are called the ventricles. And if we're talking about one of them, just simply ventricle. The main goal of this chamber is to pump blood out of the heart. Therefore, they do have a thick wall. Basically, they have, another sense, a thick myocardium. Again, the thicker the myocardium, the stronger the heart is going to contract in that region. You have patterns of the muscles inside called trabeculae or trabecular cornea. And looking at the right and left ventricle, the right ventricle is thinner wall because it only needs to pump the blood to your lungs. Again, right side is deoxygenated blood, which means that blood needs to go to your lungs to be oxygenated. Location of the lungs on either side of your heart, therefore there is no significant pressure requirement to pump the blood in the distance, the short distance. However, when we look at our left ventricle, the thickness of the wall is 2 to 3 times thicker than the right ventricle, and that basically allows it to create enough pressure through the pumping action to send blood through the systemic circuit, which is basically the rest of your body. Looking at this on a picture, This larger structure you see right here is your right ventricle. Here is your left ventricle. Again, pattern of the muscles that you see here is called trabeculae corneae. That's the background of the muscle. And I'll talk about these other additional structures as we go through the PowerPoint. The other thing that is labeled here, which I think is cool for you guys to know, is the lining of the chambers of the heart. Again, it's the endocardium, the inner lining of the heart. The thick layer is your myocardium, and the outer lining is the epicardium, which is the same as the visceral layer of the serous pericardium. Now, let's look at some of the main blood vessels that are supplying the heart with deoxygenated and oxygenated blood, and then the ones that basically collect the blood from the heart and either send it through the pulmonary circuit or the systemic circuit. So generally, when we use the word arteries, arteries are identified as blood vessels that are moving blood away from the heart. It has nothing to do with the type of blood that we have. It's not the color of the blood, again, quote unquote, red or blue, that is identifying arteries. It is rather the direction they move the blood away from the heart. Now, what are the main arteries that we have? We have two main arteries. One is called the pulmonary trunk, which is originating from the right ventricle, and is sending the blood through the pulmonary circuit. And again, I'm going to kind of show you with the highlighting of the blue color. Because this blood is from the right ventricle, right, automatically you should now know right is implying that blood is deoxygenated. Now, the next blood vessel we have, as in terms of main arteries, is the aorta. Aorta is the one that is associated with the left ventricle. Again, left is always oxygenated, depicted with red. And this is the one that's going to be pumping blood to the body, to the tissues, or through systemic circuit. Now, opposite of the arteries, again, regardless of their color, we have veins. Veins are the blood vessels that are moving blood back toward the heart. So basically, they're collecting blood in another sense. The main blood vessels that are found in the left-hand side in terms of veins is pulmonary veins. And pulmonary veins are returning or transporting blood that is oxygenated from the lung to the left atrium. The keyword automatically, again, when you guys hear or think about the left side, you have to think about oxygenated blood. And again, the other two main blood vessels we have is superior and inferior vena cava, which are transporting blood from the body or your systemic circuit into the right atrium. Again, keyword here is right atrium, implying that the blood will be deoxygenated. So let's look at this, and again, we'll go back to the picture in just a few minutes. So atria, which are the receiving chambers of the heart, are your thin walls, right? This is the same concept we talked about. They are connected to the auricles, which are basically, the addition on top of the atria, you have these little pouches or appendages on top of the atria, which are called the auricles, that help increase the volume of the atria. The blood that is received by the right atrium is from the body. The muscles inside is the pectinate muscle. And again, the blood that is receiving are from superior and inferior vena cava, which are the two we already talked about. We mentioned it, and again, look at the color coding, they're blue. The one that I didn't mention to you guys earlier is the coronary sinus. Coronary sinus is returning blood from the heart that is deoxygenated. So a lot of people get confused about that, but please do keep in mind that the heart itself is a muscle, which means it requires a lot of energy. And for creating that energy, it requires oxygen. So it uses oxygenated blood and then returns the deoxygenated blood through the coronary sinus back into the right atrium. Now, what are the differences between the superior and inferior vena cava? Superior vena cava is, as the name implies, is superior as it comes from the top of the heart, and it's returning blood back from the body regions that sits above the diaphragm. So basically your arm, your chest, your neck, and your head. And inferior vena cava implies lower or bottom. That collects blood from anything below the diaphragm, which includes the abdominal pelvic cavity, as well as your lower limbs. So where are these blood vessels in our heart? So again, kind of identifying the structure. Here is your right atrium. Here is the superior vena cava coming from the top, and here is basically where it enters. This blood vessel is your inferior vena cava, and here is basically where it enters. So kind of imagine these are the openings for the superior and inferior vena cava. Now again, blood is going to go down into the right ventricle, and the right ventricle is where the blood gonna get pumped outside the body. So let's take a look at the passage of blood from here. Now again, when your right ventricle is gonna pump, it's gonna pump blood out of these large or thick blood vessels you see right here. Notice the direction. First of all, the direction is away from the body, so means that's an artery, and it's directed toward your lungs, so we're gonna call it pulmonary. Now, because this is a thick branch of the blood vessel, it's called the pulmonary trunk. It is still an artery, okay? So don't confuse that. It's just a very large artery, so we call it a trunk. Now, what you also notice is that pulmonary trunk is going to branch to two branches. One is going to go to your left lung, which forms your left pulmonary artery. And the other one, which I'm gonna kind of show you as dashed line here, is this one that is poking up right here. And this would be your right pulmonary artery that is destined for your lungs. So blood comes in as deoxygenated blood through superior and inferior vena cava. It empties into the right atrium. Gravity pulls the blood mostly down to the right ventricle. Right ventricle is the pump, so it's going to push blood out through the pulmonary trunk, through the two pulmonary arteries to your lungs for the purpose of the blood being oxygenated. Now, when that blood is oxygenated, again, it gets picked by your veins. These veins are coming back toward the heart, hence vein imply toward the heart or moving blood toward the heart. Because they're coming from your lungs, we call them pulmonary. So notice here, we have two left pulmonary veins. Basically, they come from your left lung. And these two you see right here, again, in reality, they're not emptying into the right atrium. And I'm gonna do the dashed line for you guys to kind of see this. They go behind the heart and they actually empty right here, which is your left atrium. So the right pulmonary veins actually, again, empty into where? Into your left atrium. They go behind the heart to get access to the left atrium. Now, blood comes into the left atrium. Gravity pulls most of that blood down to the left ventricle, and then blood gets pumped. This is, look at the thickness of the wall, guys, it's pretty thick. So blood gets pumped through the largest blood vessel, which you can see kind of highlighting again. I'm gonna do the arrow through this thick blood vessel you see right here called the aorta. This blood is destined for your tissues for the goal of basically giving your tissue oxygenated blood. Now, in terms of aorta, there are parts of it, and I'll talk about it in just a few minutes as well, or in our next lecture, I apologize. You have the part that moves the blood up. So this region right here moves the blood up. So this part is known as the ascending aorta. You have the curvature, which is called aortic arch or arch of the aorta. And then blood starts to move downward. So this part, which is also goes behind the heart and pokes out right here, is referred to as the descending aorta. So you have an idea of what the circulation of the blood inside the heart looks like. Now, let's take a look at the 4 valves of the heart. So the 4 valves of the heart are branched or groups to 2 main groups. One is called atrioventricular and the other one is called semilunar. Now, I'm not going to associate any specific color with these because, again, these are valves, but understand that, again, they're located either on the right-hand side, dealing with the oxygenated blood, or on the left-hand side, basically where the oxygenated blood passes through. So look at the first name, guys, atrioventricular valves. These valves would be located based on their name between what? Your atria and your ventricles, right? The name is implying. And semilunar is based on their shape. Basically, they will be half moons. So again, this half moon shape that you have is depicting the, basically creating the name semilunar for these valves. Now, let's take a look at what are the functions associated with these 4 valves. So the first set of valves are your atrioventricular valves. You have 2 of them. One is located on the right side, one is located on the left side. Now, the goal of these atrioventricular valves is to prevent the backflow of the blood into the atria when your ventricles are contracting. So let's take a look, guys. Here are my ventricles, and I'll show you the names in just a second. Here are my 2 ventricles. So what we have discussed is blood is coming from the 2 atria down to the ventricles, right? And these ventricles are basically going to pump and push the blood out through the pulmonary trunk or your aorta. But imagine, I'm just going to describe it on one side, but it's also going to be true on the other side. So if I contract this ventricle, there's 2 paths for that blood to take. It can go to its actual route, which wants to go, which is your pulmonary trunk, the blood vessel, or the blood can move back up to the right atrium because nothing is blocking that blood to go back up. So basically, you can go either this way or you can go out this way. So do I want that blood to go back to my atria? And the answer is no. I just brought this from the atria. Why do I want to pump it back again? So what I do is I engage these valves right here, which are again on either side, called the AV valves or atrioventricular, because they sit between my atria and ventricles. Now, the one that you see on the right-hand side or your right AV valve has 3 little flaps or cusps and therefore called tricuspid. What is the main goal? Again, it's preventing backflow of the blood to your right atrium when the right ventricle is contracting. On the left-hand side, we have the mitral valve or left AV valve or bicuspid. Bicuspid implies that you have 2 cusps or 2 little flaps that makes the valve, hence the name bicuspid. Again, what is the job of this valve? It prevents the backflow of blood to the left atrium when your left ventricle is contracting. Now, notice that these valves are actually secure with these strings you see right here and right here. These strings are called chordae tendineae or tendini, And these are connected to these muscular structures or finger-like extension called papillary muscles. So what are these exactly? So chordae tendineae needs to be anchored. The cusp of your AV valve need to be anchored by these string called chordae tendineae. And chordae tendineae basically attach themselves to the papillary muscle to secure themselves. So kind of think about, if I want to think about it, and if the analogy doesn't work, you can ignore it. The valves are going to be my tent. The chordae tendineae are going to be the cords that are going to hold my tent. And the papillary muscles are the nails that holds the tent in place by keeping the cords in place. So again, these are my muscles, which are my nails. These are the cords or the stripes or the strips of ropes that are holding my tent, which is my valve, in place. If these valves are not held in place, every time they contract, they can actually flip into the atria. So kind of imagine this. Blood is hitting right here. These valves are gonna go into the closed position, but if they're not secure here, these valves literally can just move up into the atria. So it can flip up into the atria, which is not an ideal condition for us. This is an actual picture for the papillary muscle securing the chordae tendineae, and up here would be my valve right here. So valve is up here, chordae tendineae, and papillary muscles. Now, the second set of valves we have, as I mentioned, are called semilunar or SL valves. These are preventing the backflow of blood into where? Into the ventricles from the arteries. And this is when your ventricle are relaxed or relaxing. So let me show you a picture and then we'll take a look at the concept in just a minute. Let me go back to here. So here are the view of my one set of valve, which is that's on the left-hand side. And here's my second set of semilunar valves. So again, imagine your left ventricle has contracted and pushed the blood out this way, okay? Now, as this ventricle starts to relax, the blood wants to come back because the gravity is working on that blood. So you push the blood out, but as soon as you relax the ventricle, blood says, oh, I want to come back down to where I came, right? But you don't want that to happen because you just push all of that blood out through the artery. So what do? You engage or close your valve, your semilunar valve right here. Repeat the same process when we're talking about the aorta and the left ventricle. Left ventricle contracts, blood gets pushed through the aorta. Left ventricle relaxes, blood says, I want to come back down. What do? You want to engage the left semilunar valves to prevent the backflow of the blood into your left ventricle. So the name of these valves come from what is the blood vessel they're associated with. So pulmonary semilunar valve is associated with the pulmonary trunk on the right-hand side. And again, it prevents the backflow of blood into the right ventricle that is relaxed. Aortic semilunar valve or aortic valve is associated with the left ventricle and aorta. And again, it's preventing backflow when your left ventricle is relaxed. Here is the depiction of these valves. Notice how the heart is contracting here. So blood is being pushed out. And again, notice here is my semilunar valve. They are open, allowing the blood to come out. Now, notice again, these are my semilunar valves. Blood is passing through it. When the heart is relaxed, notice blood wants to come back down, but these valves come together, right? These their little cusp come together and basically prevent the blood from coming back down. So this doesn't happen. So this is the engaged semilunar valve. This is basically an open semilunar valve. Here in this picture, kind of depicting the same structure on a real human heart. Here is your tricuspid. Here is your bicuspid up there. The little strings are your chordae tendineae, connected to very visible papillary muscles you see right here. And lastly, you see right here, these structures is your pulmonary valve, and making this your pulmonary trunk. Here's a different view of these. Again, notice you have 3 cusps here, making this your tricuspid on the right AV valve. Here you have 2 cusps, making that your bicuspid or your mitral valve between the left atrium and left ventricle. And these are basically your half moons, if I want to kind of draw them for you. And again, this is not the best depiction, but kind of give you the idea. These are my semilunar valves. Again, notice here is my aorta. So you can see the color coding as well. That's the aortic valve, and here's my pulmonary trunk. So that would be called the pulmonary valve. Couple of imbalances or homeostatic imbalances. You can have what we call incompetent valve, which basically blood backflows, so the heart has to repump the same blood over and over again. You have valvular stenosis. This is where the valves are stiff when they're trying to open. So they basically constrict or limit the opening of the valves. So the heart needs to exert significant amount of force to push these valves open. And in many cases, if you do have defective valve over time, if the defect gets worsened by age, then it can be replaced by either a mechanical valve, and valve that is coming from a cadaver as a result of the donation, or from animal. Typically, pigs are going to be a better source in terms of valve transplant. Okay, so we're going to stop here. For our next lecture, we pick up reviewing some of the structures we already described, and then get into more details about the coronary blood vessels and some of the conditions associated with that.